Alright, so this is the position you need to put the patient in to help the blood drain from the inferior part of their body up to the superior. It will just, gravity will help keep it down this way. And as you can see, these vessels are really good. And even a patient has like poor vessels in their arms, like most of the time on most people, these are always still pretty good. So this can be really easy to do. It's just more intimidating for the patient and maybe for the person putting them in, but they're pretty easy. And yeah. Okay, so now we're going to clean the site. I like to wear a mask because sometimes I get really close just to make sure my breath doesn't get on the site and it stays clean. So first we'll just use an alcohol prep pad. We'll make sure her hair is out of the way so when we put this tegaderm it doesn't get her hair stuck in there and potentially rip it out when it's time for it to come out. So we'll just use this alcohol prep pad. And then this ChloroPrep, an additional cleaner. We can really scrub this whole area. Make it really nice and clean. And then it's very important to let it dry because that's when it actually does the real cleaning. That evaporation time will give it enough time to potentially kill any bacteria on the outside of her skin so we don't push that into the vessel when we put the needle through. So we want to make sure it's totally dry before we even poke her. And it'll hurt less too. If it's wet and you poke a needle through it, it burns. Good. Alright, so now we have our needle. It's all clean and it's dry. One thing you want to do is you still want to anchor the skin. So we're going to put the needle about right there. You still want to anchor it so it doesn't move, but you don't want to pull too hard an anchor that you flatten out the vein. So I like to go like this, and then you want to bear down for me really good, like we practice. Perfect. See, it's bulging out, and then we can just go. Perfect. We have a flash. We're going to advance the catheter. Needle's out. We are in the vein. Or is it relief for you?
No, that was not that bad.
And then we're going to connect the tubing. And the one thing about these, compared to other IVs, is sometimes they don't drain down the line as fast. See, I'm draining the blood down, but it's not coming out that fast. But we're nowhere in because it's still draining. On a vein that has a tourniquet connected to it, it has a lot more pressure. But we know we're in there. So we're just going to let it drain down. Man, it's taking too long to drain. So we're going to just pull a little bit of blood out to get that potential air out. Let's secure it down. Let me just put the tourniquet on just like that. And all these tegaderms are a little bit different depending on the brand and what kind of IVs you have. And then I'm just going to come in this drawer. It's kind of out of the shot. And since it didn't have enough pressure to drain that blood down, we're just going to pull it out to make sure there's no air in the line. And it's pulling back really easy. As you can see, I can just fill this up. So we know it's in there too. It's not tricking us. Now, this is all good for medications or whatever they need for their treatment. One thing to note with EJs though, if you're doing them, you should only do it one poke on one side. Because if you poke one side and the vein gets damaged and it starts bleeding in that area and swelling up, it can cause it to swell up to potentially block the patient's airway. And so if you poke both sides and it's swelling on both sides, they can cause some angioedema and potentially this patient might have to be.
I always examine both sides, although we're realizing we're going to do it on the left side. We always examine both sides for basically our largest vein that we can actually find. You have an external jugular and you have an internal jugular. This is your external jugular running, as you can see right here. You actually have a cave. You have a deviation between the large jugular here and on both sides. We also look on the other side to examine the other side and see what we have over there. Obviously this is not as large, so we've chosen the left side to actually do. Now, at this point in time, what you want to do is you want to prepare the patient by telling them what you're going to do. This is a procedure that will scare some people, so they want to be aware of we're going to be putting a IV access into your neck. Now, that being said, the skin is a little bit tougher, a little bit harder to access, so we want to use usually a large bore needle, a 20 gauge, a 18, something that actually pierce and cut through the skin really quickly. This is something that you want to do on the first case. You won't be fishing around in someone's neck. There's a lot of veins, arteries, nerves that you don't want to hit on a patient. So we want to clean the area very well. Perfect access to what you're actually looking for. Now, when I tell you to, what you're going to do is you're going to have the patient bear down like they have to have a bowel movement. And what they'll do is they'll bear down for me one time, thank you. On the next exhalation, we'll actually put the needle in, okay? So we're going to breathe in real big. And we're going to breathe out. One big pinch here, 1, 2, and 3. And there you go. And you actually see a flashback. And we get a little squeeze here. Put your F on, and you can retrieve your blood at that time. Never put on the occlusive or the tape until you actually go ahead and get your blood, because these are always positional. Notice we got good blood retrieval. We'll take this off. We'll go ahead and tape this down.
I was looking for keys. The one.
Put our bio-occlusive on very cleanly.
Okay.
And once again, do not forget, we've got our patient laying on their head, so we want to drop them, breathe them back up. Now, be aware, this will always be, EJ are always positional, so we're going to tape it really good. Sometimes you'll have facial hair, you'll have things that'll get caught in these, so we want to tape this really well in that area, clean up your site, tape it really well, and that's how you insert an EJ. Doesn't typically, but it serves our purpose. Let me get that out.
Good. Yeah. Good stuff.